Class 7, Overcoming Possible Breastfeeding Difficulties. Breastfeeding your baby is supposed to be an enjoyable experience, but because it's a learning experience for you and your baby, it's not uncommon for mothers to experience some minor bumps along the way. The good news is that these difficulties can often be fixed pretty easily with very little assistance. The early days of breastfeeding are very special. You both have a lot to learn about each other and how you will work together as a team. You and your baby have been together for 9 months. You know your baby's needs better than anyone, and your baby finds comfort and peace when he's cuddled up next to your warm body. Your baby has never had to work for food before. He was fed constantly through the umbilical cord, where he could hear the continuous comforting sound of your heartbeat. Now he must obtain nourishment from your breast, and it takes practice for both of you to learn this new skill. These first days don't always go as planned. Sometimes it takes a little while for the two of you to get in sync. If you encounter problems in the first 3 days, you can usually get assistance before you leave the hospital. The most common problems in the early days are due to the mom's or baby's inexperience with feeding. Remember, breastfeeding is a learned skill, and it takes practice. Let's look at a few of the more common challenges that mothers and babies may experience. There are several different causes of latch difficulties in the first few days after birth. You and your baby have gone through a very physical and exhausting experience during birth. Your baby may be very sleepy and may not feel like nursing frequently in the first few days. It's important to watch him for early cues that he may be a little hungry and may attempt to nurse. Sometimes it helps to ask the nurses to limit visitors in the first few days, so you can take advantage of this time to learn your baby's signals. When baby is in a lighter sleep state, it's easier to wake him up and encourage him to nurse. He may show signs of squirming, making little noises, and may put his fist close to his mouth. This is a good time to take the blankets off, change a diaper, and put baby skin to skin to encourage breastfeeding. Don't worry if your baby cries whenever he goes to the breast. It doesn't mean your baby doesn't like to breastfeed. Crying when attempting to latch is common in the newborn period. Babies have never had to work for their food before, and the only way they know how to communicate is to cry. Learning to breastfeed is their first learning experience. Be patient and try to remain calm. Remember, every baby has to learn to breastfeed. Sometimes letting the baby suck on your finger for a minute or two will calm the baby. A trigger for the baby to suck is when he feels your nipple up at the roof of his mouth. If baby is having a little trouble latching to the breast, try aiming your nipple towards the roof of his mouth and holding it there until he feels it in his mouth. Trouble latching is most likely temporary. It will get better as the baby learns how to nurse. Just ask for help from the lactation consultant or your nurses. And remember, your baby loves breastfeeding. He just has to learn to make it easier. Don't be tempted to give your baby formula or a bottle at this time, unless medically necessary. It can make the problem worse and might discourage him to continue breastfeeding. Sore nipples when breastfeeding is usually a short-term problem due to the baby's mouth not being positioned correctly on the breast. When latching to the breast, it's important for your baby to open his mouth wide so that he can take a big mouthful of breast into his mouth and not just suck on the nipple. If the nipple soreness usually occurs at the beginning of a feeding, lasts a few seconds, then goes away, consider it as temporary. It will lessen and most likely go away in a few days. If it's extremely painful when the baby latches to the breast and the soreness continues throughout the feeding and remains painful at completion of the feeding, then tissue damage can occur. If breastfeeding hurts, ask your nurse or lactation consultant for help. The latch can be corrected. Breastfeeding is not supposed to be painful. If your nipples are sore, be sure to tell your nurse. She can show you how to position the baby correctly at the breast. For comfort, begin nursing on the least sore side first. After feeding, you may rub some expressed breast milk into the nipple. That aids in healing. Some mothers like using purified lanolin product on their nipples, and others like the comfort of cooling hydrogel pads between feedings. Breastfeeding is not meant to be painful. If the pain continues or if your nipples crack or bleed, be sure to get help by calling your lactation consultant, doctor, or midwife. Most women experience breast fullness about 3 or 4 days after giving birth. This is a sign that your milk is changing from colostrum into mature milk and is increasing in volume. But sometimes your breasts begin producing much more milk than your baby can take in at a feeding, and they may get very, very full. Your nipple can flatten out, and it can be quite difficult for the baby to latch on. Expressing or pumping a little milk to pull out the nipple and soften the breast can make it easier for baby to correctly latch on. Wearing soft breast shells between feedings can also help to keep the area around the nipple soft, so it's easier for baby to latch. If your baby falls asleep after feeding at the first breast and won't awaken easily, you may want to hand express or pump the other breast to relieve the fullness and keep from getting engorged. This is a temporary situation, and after a few days, your breasts will synchronize milk production to the baby's needs, and the extra fullness and swelling will decrease. Breast engorgement refers to hard, red, swollen, and painful breasts. It can occur in the first few days after going home from the hospital when feedings have been skipped, formula supplements have been given, or if the baby is not feeding frequently enough. This, too, is a temporary situation, so try not to worry. Ice packs work well to reduce the swelling. Relief from breast engorgement generally comes with breastfeeding, hand expressing, or pumping. Assist baby to latch to the breast by hand expressing or pumping a little milk to soften the nipple and areola before breastfeeding. If your breasts are still hard after breastfeeding, use a breast pump to relieve the pressure and get some of the milk out. You only need to pump after feeding a time or two, just so your breast can recover from being engorged. Some days it may seem as though your newborn baby wants to breastfeed all the time. After you nurse him, change his diaper and put him down, he's crying and wants to nurse again. This is normal newborn behavior. Just go ahead and breastfeed again and again. You do not need to limit the time your baby feeds at the breast. All babies know is that breastfeeding makes them feel comforted and secure. Being in mother's arms is where they need to be. In a minute, we'll cover the signs breastfeeding is going well, and as long as these signs are present, then you don't need to worry about baby's frequent nursing. In the first few days after birth, especially if they were born before their due dates, some babies just want to sleep all the time and don't want to nurse frequently enough. If this is the case, try keeping your baby naked against your bare skin, with both of you covered by a blanket, instead of swaddling the baby by himself in blankets. Also, watch your baby for subtle hunger cues, such as squirming, putting its fist close to his mouth, smacking his lips. These are times when the baby can be encouraged to nurse. You don't have to wait until he cries. That can be a late hunger cue, and he may go to sleep at the breast instead of nursing. Don't give the baby bottles of formula unless your baby's doctor has determined it's medically necessary. Giving formula can decrease the amount of milk you make and can derail breastfeeding right in the beginning. Always arrange for follow-up with your baby's healthcare provider to get clarification. Many mothers are concerned whether they're making enough milk for their babies. Remember, your body grew this baby. Your body can feed this baby. In the first few days, your breasts produce the exact amount of colostrum that the baby can hold in his tiny stomach, only about a teaspoon. In the days to come, your body begins the process of producing mature milk, and by about days 3 or 4, you will be producing milk and keeping up with your baby's needs. If you have any questions or don't feel your breasts are filling by day 4 or 5, be sure to mention it to the baby's healthcare provider so baby's weight can be checked. Most mothers and babies are discharged from the hospital 24 to 48 hours after birth, so many times breastfeeding has not had enough time to become established. It generally takes until baby is about 3 or 4 days old before a pattern becomes established. Here are 6 signs that can help assure you that breastfeeding is going well. Baby breastfeeds 8 or more times in a 24-hour period and seems satisfied after most feedings. By day 4, the baby has at least 4 wet diapers in 24 hours. By day 4, the baby has 3 or more poopy diapers. By day 5, the baby's stool color has changed from greenish-black to yellow. By day 5, the baby gains a little weight and will regain his birth weight by 10 to 14 days of age. And baby is happy and content after most feedings. There are times and situations when a little extra help may be needed. If your baby is 4 or more days old and is not waking to feed at least 8 times in 24 hours, or is having less than 3 stools in 24 hours that are still greenish-black in color, is wetting fewer than 6 diapers a day, and has lost more than 7% of his birth weight. Then your baby's healthcare providers should be notified, and you may need to be seen by a board-certified lactation consultant. It doesn't mean that breastfeeding isn't working. These signs are indications that assistance is needed. In the next class, we'll discuss breastfeeding in special situations when pregnancy and birth doesn't go as planned.